Hi, my name is Jim McLarney. I'm a physician assistant at emergency room in Worcester. I've been there for about 4 years. Here to tell you about my experience with the vaccine from what I've heard from colleagues as well. Just COVID in general. So I received the first dose of vaccine December 9th, I believe, Friday morning. And then the second one about 21 days after. It was a little bit later. I just got it this past Saturday morning. The experience was great. The first dose, felt a little soreness in the arm. Other than that, really no symptoms whatsoever. The second dose, as expected, you're going to have a few more symptoms. These can include muscle aches, headaches. Some people have spiked fevers. In my experience, though, I just had some very vague headache the next morning and a little bit of muscle aches, but I actually worked the next day. Nothing debilitating at all, and again, no fevers at all, and really felt fine. Again, in terms of the soreness, it felt like a typical flu shot, or even like a tetanus booster, something along the line of that. Again, nothing a little bit of Motrin and Tylenol wouldn't help you with. Some common misconceptions about the vaccine that people, I think, have some anxiety and hesitation about is that the vaccine isn't giving you COVID. This is the symptoms that you would get from the vaccine are really your body's immune system responding to it. So the presence of symptoms is actually, it can be thought of as a good thing. That means it's working and that your body is fighting it off. And, it's not COVID itself. This is a blueprint for your body to recognize COVID if it comes across it, so it can attack it and hopefully defeat it in a more specific way, and not just a typical virus. It would recognize it and again attack it in a specific way. Other myths and concerns about it too is how fast this vaccine was developed. It was relatively quick, but the science behind it and the method of it is not a new technique at all. mRNA vaccines have been around for quite some time, and it's the same background as other vaccines. So while it took only about 9 or 10 months, this technology and science behind it has been around for many, many years. So it has been proven safe from the studies that have been out there. Long-term side effects, yes, those studies aren't out there, but so far so good from what I've heard and from what I've read. So again, it appears safe and effective. The one thing I would say is if you are a healthcare provider or somebody who's at risk who received the vaccine, not everyone is as lucky as you or I. So it's important to continue safe social distancing practices and wearing a mask, because there is some evidence that you could still carry it and pass it along to people. So, definitely not over. This is the light at the end of the tunnel. But again, it's certainly important to continue to wear your masks and social distance. From my experience with COVID, at the beginning of all this back in March and April, we've learned a lot from it. I think we had a lot of patients that got very, very sick at the beginning of the pandemic. And we heard a lot about it in Massachusetts because we had so many cases. It seemed like the West Coast and even the Southwest didn't have a lot of cases, but now they're really feeling the pressure of it. So the cases have certainly gone up in the past few months. Even in the last few weeks, I've seen a ton of cases, ranging from mild symptoms that we discharged to people that have ended up in the ICU, in intensive care units, and people that needed a lot more help than just Tylenol and Motrin and those sorts of things. But we know a lot more about it, which I think the management has become less overwhelming. We're familiar with it. We know to be safe in pretty much every patient's room at this point, because anything can present with COVID. So the cases have gone up. I think it has been related to recent holidays and family gatherings again that shouldn't have happened, but I can understand why people miss their families. But I think we're starting to see a spike in those cases after the holidays because of that. But they've kind of plateaued out right now. By far, we're not over it by any means. But with the vaccines coming out, and the safety and efficacy of them, it's certainly reassuring, and I think there is a light at the end of the tunnel. But I can't stress enough, continue to practice social distancing and wear your masks, which I know is repetitive, but some people still don't get that message, even though we're coming up on almost a year now. But continue to do those things and keep everyone safe, regardless of the vaccine. I'll leave it at this. If you have the opportunity to get the vaccine, I would strongly recommend it. I think it's safe. I think it can be proven effective. I got it. I was thrilled to get it. And again, I highly recommend it to anyone.